Om Swastiastu. Assalamualaikum warahmatullahi wabarakatuh. Shalom, Namo Buddhaya, and greetings for everyone. I would like to say thank you first to every parties involved so that we, SGD B3, could present our paper titled Extrapyramidal Syndrome. First of all, I would like to introduce myself. My name is Bagus Tresna Indra Putra Pramana with the last 3-digit number 104. Here are the members of SGD B3, and let's start with introduction. Antipsychotic drugs have played a very important role in recent decades in treating schizophrenia and other psychotic disorders. These antipsychotic drugs work by suppressing certain psychological functions in patients, but do not affect normal functions for daily activities. However, until now, the mechanism of action of antipsychotic drugs is not fully known, and their efficacy varies for each person. This can result in the need for more than one type of medication to treat depression symptoms completely. In people with schizophrenia, antipsychotic drugs can help reduce hallucinations, delusions, and can treat disturbed thoughts. However, the use of these antipsychotic drugs can cause side effects. Each antipsychotic drug has a different side effect profile, ranging from mild side effects to deadly side effects. Apart from that, there are also side effects on the neurological system, which are called the extrapyramidal effects.
Okay, my name is Putu Chandrika Dewi with the last 3-digit name 71. So here I will continue to present about the background. Extrapyramidal syndrome or EPS is an unwanted adverse reaction that develops as the result of the use of antipsychotic medication and causes movement disorders such as dystonia, akathisia, Parkinsonism, and even tardive dyskinesia. This syndrome has been reported in 50 to 70% on antipsychotic drug patients and also reduced their quality of life. Based on that, more research is required to understand EPS in order to perform early detections and reduce the effects that may arise. Common formulation in this paper are what is the definition, epidemiology, etiology, pathophysiology, diagnosis, management, differential diagnosis, and the prognosis of extrapyramidal syndrome or EPS. The purpose are give the information about the same thing as the problems in formulation, and the benefit that we hope is to present proper information and a great insight about extrapyramidal syndrome or EPS for improving its knowledge. Okay, that's all for me. The next presentation will continue with my colleague. Thank you.
Okay, hello, doctor. My name is Michael Jonathan Raya with three last digit student ID number is 182. Today I'm going to explain the definition of the extrapyramidal syndrome. So the role of the extrapyramidal system in humans is to maintain posture and regulate involuntary motor functions or inhibiting involuntary movements. The extrapyramidal syndrome is a movement disorder usually caused by antipsychotic drugs. The antipsychotic drugs themselves have been established well in the past few years, yet it is associated with wide range of side effects. The variety of movement disorders manifested by EPS can be acute, including dystonia, akathisia, Parkinsonism, and chronic conditions like tardive akathisia and tardive dyskinesia. EPS symptoms interfere with patients' daily life, potentially disrupting their social functioning when performing tasks or and also manifesting communication problems. EPS often lead to a refusal to continue medication, which may result in relapses and rehospitalization. It is crucial to periodically evaluate patients to achieve balance between the benefits and the potential risks of antipsychotic drugs. Research indicates that antipsychotic drug medication is the major treatment given to mentally ill patients, although there are alternative treatment like cognitive behavioral therapy, which has proven to be effective. And that's all from me. Thank you.
Allow me to introduce myself. My name is Yohanes Nicholas with the last 3-digit number 089. The prevalence of EPS in patients is closely related to the class of drug prescribed. EPS is more common in patients taking typical antipsychotics, TAP, at 51.5% compared to atypical antipsychotics at 24.4%. Among TAP, haloperidol was the most frequently prescribed and had the highest prevalence of causing EPS with the percentage of 42, 74, and 44% among patients who received haloperidol alone, a combination of haloperidol with other AAP, and a combination of haloperidol with TAP, respectively. Among AAP, quetiapine has the highest prevalence of EPS at 42%, followed by clozapine, risperidone, paliperidone, olanzapine, aripiprazole, and amisulpride with the prevalence rate of 39, 37, 36, 30, 27, and 10%. As an EPS symptoms, dystonia tends to occur rarely, which only occurs in only 2 to 5% of cases, but may increase significantly to 90% in young men receiving potent parenteral antipsychotics like haloperidol. The prevalence of Parkinsonism was higher in patients using TAP compared to AAP at 44 versus 37%. The highest prevalence of akathisia is associated with the use of haloperidol, ranging from 15 to 40%, which is 7 times higher than the akathisia prevalence caused by AAP, ranging from 0 to 10%. Around 20 to 40% of people with EPS experience tardive dyskinesia, with the half of chronic EPS patients still having it, while 10 to 30% get better, and another 10 to 30% get worse.
Hello everyone, allow me to introduce myself. My name is Patricia Clarine, and today I'm going to be explaining the etiology of extrapyramidal syndrome. So extrapyramidal syndrome is mainly associated with the consumption of first-generation antipsychotics, such as haloperidol and phenothiazine neuroleptics, which are centrally acting dopamine receptor blocking agents. So what happens here is that dopamine blockage or depletion in the basal ganglia cause idiopathic pathologies of the extrapyramidal system. Some facts about this is that extrapyramidal symptoms occur less frequently with atypical antipsychotics compared to typical antipsychotics, and other agents that block central dopaminergic receptors can also cause extrapyramidal symptoms, such as antiemetics, lithium, SSRIs or selective serotonin reuptake inhibitors, stimulants, and also TCAs or tricyclic antidepressants.
Hello, my name is Dewi, with the last 3 digits of my student numbers are 146. Majority of current antipsychotic medications work by reducing dopamine transmission as partial agonists or antagonists at dopamine D2 receptors. Antipsychotic decrease the inhibitory effects of dopamine, which increases cholinergic interneuron wiring and acetylcholine release, which this route is suspected to be involved in Parkinson's disease-related acute dystonia. Antipsychotic decrease the dopamine level in brain, which suspected to be involved in Parkinsonism and akathisia. Antipsychotic inducing the overexpression of D2 receptors and supersensitivity of postsynaptic dopamine receptors, which suspected to be involved in tardive dyskinesia.
My name is Komang Mahottama with the last 3 digit study number 221. The research journal states that patients are considered to meet criteria for Parkinson's disease if they score 1 on at least 2 of the 6 Simpson Angus scale items or 2 on 1 factor. Patients were measured to meet the criteria for akathisia if they scored at least 2 on the general section of the Barnes akathisia rating scale. They were diagnosed with suspected dyskinesia when they scored 2 on at least 2 items of the abnormal involuntary movement scale or 3 on 1 item of the AIMS. The effect of antipsychotic drug is to attenuate dopamine transmission through antagonistic or partial agonist action. The range between the therapeutic dose and the dose that lead to side effect varies across types of medication. Extrapyramidal motor symptoms such as dystonia and Parkinsonism are the main side effect mediated by a blockade of D2 receptor signaling in the nigrostriatal and tuberoinfundibulار dopaminergic circuit. Apart from that, akathisia and tardive dyskinesia are further symptoms that will appear if drug exposure is carried out over a long period of time. Extrapyramidal symptoms affect a person's efficiency, function, caregiver burden, and quality of life.
Hello, my name is Yanti Graciella with my last 3 digit NIM number is 162. I will explain the next part. Dystonia. Dystonia is a condition where the muscle contract continuously and cause abnormal movement or postures. Acute dystonia can occur not long after antipsychotic are given and can also occur after administration of higher doses. Usually, dystonia can caused by antipsychotic occurs in a certain area only. However, it doesn't rule out the possibility to affect a group of muscle and cause pain. Some dystonia that can be life-threatening are laryngospasm, which is a condition where the vocal cords experience stiffness so that airflow to the lungs can be obstructed. Akathisia. The symptom is divided into two components, namely subjective and objective components. Subjective component is a component feeling of restlessness where the patient always want to move. Symptom feel discomfort and not painful. The objective component involve repetitive complex movement that can be seen like restless leg. Parkinsonism. Manifestation of Parkinsonism can be in the form of the Parkinsonism triad, namely bradykinesia, rigidity, and tremor. Other symptoms that are easy to find are lack of cohesiveness of limbs, unusual gait, hypomimia, silarrhea, and lip tremors or rabbit syndrome. In addition, postural tremors will occur more often than resting tremors. Tardive dyskinesia. Dystonia and tardive dyskinesia can appear similar and are sometimes difficult to differentiate due to their late onset. The diagnosis of this symptom only needs to be made from the history and physical examination. Laboratory examination is not required, and EPS may be difficult to differentiate from malignant neuropathy, serotonin syndrome, and other movement disorder. Therefore, the doctors need to carry out the true physical examination and extensive history.
Thanks for the opportunity. First, I'm going to introduce myself. My name is Sienny with the last 3 digits of my student number is 004. The first step in managing EPS is recognizing its presence. EPS can manifest in various forms, including acute dystonia, akathisia, Parkinsonism, and tardive dyskinesia. A neurological assessment is recommended for all patients on antipsychotic drugs as a component of the screening process to detect potential neurological side effects. There are several ways to manage EPS. For acute dystonia, intramuscular anticholinergic medications such as diphenhydramine or benztropine are recommended. Akathisia may be treated with beta blockers like propranolol or benzodiazepines like lorazepam to relieve symptoms. Next, Parkinsonism typically requires circular oral anticholinergic medicinal drugs, although its effectiveness may be limited in some cases. Lastly, for tardive dyskinesia, reducing the antipsychotic medication dose is a method to achieve remission. In individuals with long-standing tardive dyskinesia, decreasing or discontinuing medicament may initially intensify the symptoms. Moreover, anticholinergic medicine shouldn't be used as it may worsen tardive dyskinesia. That's all from me. Thank you.
Hello everyone, my name is Putra Nirajanari and the last 3 digits of my student number are 049. I'm here about to explain the differential diagnosis of Extrapyramidal Syndrome. So, history of drug exposure is important to establish the diagnosis because there are non-specific symptoms of Extrapyramidal Syndrome that can be found in another movement disorder, which make it difficult to differentiate. So the first one is neuroleptic malignant disorder. So the syndrome is also occur as a side effect from antipsychotic drug. Symptoms such as muscle rigidity and tremor in the syndrome is also found in extrapyramidal syndrome. But there are still several other major criteria that are not found in extrapyramidal syndrome. And the second one is serotonin syndrome. There are major and minor symptoms such as tremors, rigidity, and akathisia in the syndrome that are also found in extrapyramidal syndrome. Even few symptoms are the same, but the causes are different because both are equally caused by the use of certain drug, but they are come from different types of drug. So that's all that I can say. The next slide will be presented by my friend. Thank you.
Hello everyone, my name is Patricia with 171 as the last 3 digit of my student number. So for the prognosis of extrapyramidal syndrome or EPS can vary depending on several factors, including the type and severity of EPS, the underlying cause and the promptness of treatment, and individual patient factors. A variety of movement phenotypes has been described along with the EPS spectrum, including dystonia, akathisia, Parkinsonism, which occur more acutely, as well as other chronic manifestations of tardive akathisia and tardive dyskinesia. In 50% of the cases, dystonia develops 48 hours after drug exposure, and in 90% of cases, it does so within 5 days.
Akathisia is characterized by an intense drive to move and a subjective feeling of internal restlessness. As a result, repetitive motions such as swinging, crossing the leg, or changing feet are frequently seen. The onset often occurs 4 weeks after starting or increasing the dosage of the problematic drug. Since the intensity of akathisia is associated with suicidal ideation, anger, and violence, this improper diagnosis may have negative consequences. Additionally, the medical professional must mention that withdrawal akathisia, which usually lasts 6 weeks or less and is self-limited, may occur when antipsychotic medication is stopped or its dosage is reduced. Tremor, rigidity, and a decrease of motor function in the truncal area and extremities are the symptoms of drug-induced Parkinsonism. Last but not least, tardive dyskinesia causes uncontrollable movement of the orofacial, tongue, and less frequently in the truncal and extremities area. That's all from me. Thank you.
Hello, I'm Wildan Almasyar, and now we're at conclusion. Extrapyramidal syndrome or EPS is an unwanted adverse reaction that develops as a result of the use of antipsychotic medication. The EPS is mainly associated with the administration of first generation or typical antipsychotics and less frequently occurs with atypical antipsychotics. Acute dystonia, Parkinsonism, akathisia, and tardive dyskinesia are extrapyramidal motor symptoms manifestation of EPS. The symptoms could appear after hours, days, or weeks after antipsychotic administration or after a dosage increment. The EPS has been reported in 50 to 70% of antipsychotic drugs patients worldwide. The effects of EPS are critical, not only in terms of treatment success, but also in patients' life quality. Therefore, it is necessary to carefully choose and administer the right dose of antipsychotic. Evaluating, monitoring, screening, and performing good follow-up also play a significant role in avoiding EPS. Since EPS is a condition that has a high possibility to occur in society, we suggest further research and development of lower-risk antipsychotic treatment so the treatment of mental problems can be more effective and safer, thus improving people's quality of life. So that's our presentation about extrapyramidal syndrome. Thank you for your attention. Stay healthy and be well.